Safety first. Accidents can occur anywhere and anytime. We can avoid most accidents if we are careful. Sometimes accidents can happen in spite of being careful. By following some of the safety rules, we can effectively prevent most accidents. First aid. Accidents occur suddenly. There may or may not be a medical facility near the place of accident. At that time, the injured person needs some first help before being attended by a doctor. This first help is called first aid. First aid is the immediate help or attention given to an injured person before proper medical help arrives. Before administering first aid, some of the steps should be kept in mind. Administer first aid quickly and efficiently. Always ensure that you wash your hands with soap and water. In case of a serious injury, send for a doctor. Different kinds of injuries need different types of first aid. Nose bleeding. Nosebleeds commonly occur due to heat. In summer, sometimes the nose of a child starts bleeding. This happens due to the rupturing of walls of the blood vessels in the upper nasal passage. Steps for first aid. Ask the patient to sit upright and tilt his head backwards. Press the bleeding side of the nose firmly with fingers. Continue holding till the bleeding stops. Place an ice pack or wet cloth over the nose and also on the head. Ask the patient to breathe through the mouth. Ask him not to blow nose. Fracture. If a bone cracks or breaks, we call it a fracture. Steps for first aid. Do not move the patient as far as possible. If the patient has to move, apply a splint around the broken bone to give a support to it. If there is a fracture in the limb, use a sling made from a triangular piece of cloth to give the broken limb a support. Try to keep the patient comfortable and call a doctor. Burn. Hot objects, boiling water, milk, steam, firecrackers, or chemicals like acids can cause burns. Burns can be minor or severe. Minor burns. Steps for first aid. Apply cold water or ice cubes to the affected part. Make a paste of baking soda and water and spread it over the burn. Apply an antiseptic like Burnol on the burn and cover the area with a sterile cloth or gauze. Severe burns. Steps for first aid. Do not prick the blisters. Cover the affected area with a sterilized gauze or a clean cloth. It will help to protect the burn from germs and dust. Dip a sterilized piece of cloth in the solution of baking soda and apply it on the affected part. Do not remove the burnt clothes if they are sticking to the patient's skin. Give the patient plenty of liquid to sip. In case of chemical burn, wash the affected part with water. Rush to the doctor immediately. Animal bites. Bites caused by pets, such as dogs and cats, are quite common. Animal bites can cause a disease called rabies. In case an animal bites, wash the wound with soap and water. Apply an antiseptic on the wound. In case a poisonous snake bites, immediately apply a tourniquet just above the bite to stop the flow of blood to the heart. This will help to slow down the spread of poison. Take the patient to the doctor immediately. Bees and wasps are the common insects that sting. Their sting causes pain and swelling. In case of a bee sting, a paste of baking soda and water should be applied. In case of a wasp sting, vinegar or lime juice should be applied.